Happy February 26th! In light of the passing of AIDS activist Hydeia Broadbent, today's Black History impact makers will be those who changed the faces of HIV from a disability lens. We continuously celebrate HIV-positive history makers like NBA legend and entrepreneur Magic Johnson, actor and singer Billy Porter, and those who've passed from the disease, like tennis great Arthur Ashe, rapper and record producer Eazy-E, spoken word artist Gil Scott-Heron, musician and Nigerian activist Fela Kuti, and choreographer Alvin Ailey. Rarely do we talk about Black AIDS activists who worked to include HIV/AIDS in disability rights and justice, like unsung heroes Phil Wilson and the late Christopher M. Bell. Phil Wilson is the founder and former CEO of the Black AIDS Institute. He established this nonprofit in 1999 to support HIV/AIDS awareness and reduce the spread of the disease in the Black community. Their slogan is, "Our people, our problem, our solution." Phil Wilson and his partner were diagnosed with HIV in the early 80s, when there was very little hope for surviving the disease due to a lack of medical treatment and heterosexism in public health and public policy. AIDS was, and many still see it as, a plague from God to punish gay people for being gay and for sin. Unfortunately, his partner died in 1989, but Phil Wilson is still here with us today, surviving and thriving. He's been through a lot, but he expressed disappointment that HIV was viewed as a disease primarily affecting white communities and white gay men, when he knew better. He knew that public health officials and policymakers were ignoring the impact HIV was having on the Black communities. So he took action. He mobilized Black AIDS activists to plead with the CDC to allocate more funding for education and HIV prevention in Black communities across the United States. The work resulted in a 5-year domestic Act Against AIDS campaign in which 14 Black orgs were awarded grants to hire AIDS coordinators to expand these efforts. The late scholar and HIV/AIDS activist Christopher M. Bell shared Wilson's intersectional approach to HIV activism, which emphasized disability, race, and ethnicity. As an academic, he served as the president of the Society for Disability Studies and expanded national discourse on race, ethnicity, and disability studies. When he found out he was HIV positive at age 23, he didn't cry or direct any hostility at the partner who infected him. He went home, he watched Law and Order, and started grading papers. At that time, Chris Bell was studying for his doctorate and would soon become a professor at Syracuse University. He didn't see HIV as a death sentence, and he's quoted as saying, "We're all dying. Nothing has changed but my level of awareness." He dealt with hate as a Black queer man with HIV who wasn't religious, but he persevered by being an educator. His first class as a Syracuse professor was Disability, AIDS, and U.S. Culture. Back then, it was the only class at that university that focused specifically on HIV and disability studies in American culture. It analyzed, critiqued, and aimed to redefine the way people think about disabled people and those with HIV/AIDS. In addition, he was also a lecturer at Towson University and changed what disability justice looked like. Though Chris Bell passed away in 2009, his legacy lives on through the Chris Bell Memorial Scholarship created by the Society for Disability Studies. The funds support students of color and non-white racial minorities doing scholarly work in disability studies, whose work supports Chris's commitment to intersectionality, identity politics, and activism. We thank them for their work and the legacy they're leaving with us.